Hi, I'm Dr. Yolanda Kirkham. I'm a gynecologist, and today we're going to be talking about painful sex or dyspareunia in menopause. There are many common causes of painful sex in menopause, so you're definitely not alone. This is a really common issue that people come to see their doctors about. As in menopause, there is a lot less estrogen or almost no estrogen produced by the ovaries anymore. Your ovaries usually produce this estrogen hormone, which is really important for keeping our vaginal tissues plump and full of blood supply. So you can imagine in menopause then that sometimes those tissues can get thinner and also more susceptible to bleeding, pain, and irritation or burning, especially when there's the friction of sex. So dyspareunia can happen on the outer vulva or the skin surrounding the vagina, or actually around the vaginal skin. And we'll talk about some of those causes. The most common cause is genitourinary syndrome of menopause. It used to be called atrophic vaginitis. What happens is, with a decreased estrogen, the tissues can sort of become thinner and resorb, and thus it's almost like chapped lips or just friction of that thin tissue can cause sometimes bleeding or pain and irritation. Please make sure you check out our other WHEMS video on postmenopausal bleeding so we can rule out any other causes of bleeding that's not related just to sex. When painful sex is due to the loss of estrogen, this can be easily treated, and this can also include non-hormonal treatments that have hyaluronic acid, for example, from the drugstore. Very effective treatment can come in the form of a vaginal tablet, ring, or cream by prescription from your family doctor or gynecologist. So please see your medical professional to make sure this is the right choice for you. Infection can also be a common cause of pain during sex. And many people in their midlife are dating again or seeing new partners. So make sure you and your partner get checked for sexually transmitted infections through urine or vaginal swabs. The most common cause is chlamydia and gonorrhea. And these can cause an abnormal discharge, but also sometimes spotting and pain on urination. Certainly infections that cause skin warts like HPV, or herpes that causes blisters and ulcers, usually recurrently in the same area in the vulva skin, these can also cause pain. There's another common infection in menopause called desquamative inflammatory vaginitis. It's important to see your doctor if you feel like there is a recurrent discharge and pain in the genitals that has not been well treated by other forms of treatment. A lot of people also suffer from skin conditions like lichen sclerosis or lichen simplex chronicus. This is more of an itching around the vulva skin and keeps coming on and off. It's often mistaken for yeast. So it's really important that you see your doctor to be checked out about your skin. Oftentimes these can cause little micro tears, especially with scratching, and it can flare up from time to time, but it's easily treated with steroid cream. Certainly, sex pain can also be related to partners, and whether it's your partner's size or positioning, that's something hopefully you can talk to your partner about. There can be lots of loss of libido too, especially if you have pain. You're not going to necessarily want to have sex, and that leads to a bit of a vicious cycle. Hopefully this is something you can bring up with your partner as well as your doctor, who can then refer you to a sex therapist or even a counselor individually, or with your partner if that's something that you'd like to do. Sometimes lubricants can be used as well, especially if you're having sex for a long or extended amount of time. Water or silicone-based lubricants are the best choices. It's important to know as well that a lot of people don't necessarily get sexual pleasure from penetration. You may want to focus on other types of sexual intimacy with your partner that's not focused on penetration if it's painful for you. Hopefully our video today has shown you some of the many common causes of painful sex in menopause and that it's also treatable. Please do speak with your healthcare professional about possible causes for you and how we can address the best treatments for you. I'm Dr. Yolanda Kirkham, gynecologist, and thank you so much for joining us today.